Learning health systems research is really taking off, and it does make me hopeful about the future of care delivery. I think Minnesota has a really unique healthcare market, a lot of large health systems with a legacy of being the vanguard in terms of care delivery, and so it's a market that's kind of ripe for innovation, ripe for this push for continuous improvement.
We can start really evaluating where patients aren't getting best practices and how can we improve that. And that's what the learning health system really is.
I think the interventional arms and the innovation arms of the learning health systems will allow us to push healthcare in a new direction, and I think a better direction.
The learning health system is a very exciting opportunity if you want to research, you want to contribute, and that will allow you to have a positive impact on a lot of people's lives.
So with the Scholars Program, I really had the opportunity to take a leadership position. So there's a lot of interest with COVID-19 in can COVID-19 be identified on x-rays? Early on in COVID, we didn't have a rapid PCR test. We weren't able to quickly identify patients that had COVID in the emergency department. We and other institutions, we have already developed a collaborative between the medical school, the Institute for Health Informatics, Fairview, and the Department of Computer Science. And we saw this as a prime example to really test our hypothesis. Can we develop algorithms that can read x-rays and predict if a disease is present or not? And that's what we found that we were able to do.
A lot of my work focuses on health informatics, use of IT in healthcare delivery, looking at transitions of care. So when patients are in the hospital and require post-acute services, they transition to a skilled nursing facility, and it's a really kind of vulnerable transition. A key part of that is challenges with information sharing between those two healthcare settings.
My main area of focus is on how patients are transferred from one hospital to another. We felt their outcomes and the process of transferring them could be improved. We did a couple of interventional studies aimed at standardizing how we communicate between hospitals and then leveraging, I think, the unique technology that Minnesota has. So we developed an intervention to leverage that, and we showed that if you did, you could significantly reduce mortality of patients who were transferred, and generally made most providers a lot happier with the process.
We are working on several projects. One of them is sepsis. We are trying to look at which patient would benefit most from which kind of interventions. So we are working with people like Mike Usher and Chris, who are in the clinical setting. They usually have questions for us that we are trying to answer with data. We are looking at the patient's entire history, not just this hospitalization, but previous hospitalizations as well. We already see very promising results.
If you really want to be a leader, if you really want to understand how do we improve healthcare delivery, how do we get rich access, and how do we develop and implement data-driven approaches to improve healthcare, the Minnesota Learning Health System program is the program to do that.